Sandra Cohen Kalter. I am recently retired from a 40-year career in the FDA medical technology space. Recently, having retired from Medtronic as Chief Regulatory Counsel and leading the enterprise legal regulatory team and supporting the company on all things related to product life cycle of products, trying to get approval, staying on the market, and dealing with post-market issues. I also have a personal connection to diabetes because my son, when he was 9 years old, right before his fourth grade year, got diagnosed with the disease. And it's a big impact when something like that hits your family with a 24/7 disease, and you suddenly bring a child home from the hospital and he is like a baby again, and you've got to learn how to take care of him. So as it turns out, Medtronic has a diabetes business, so I got engaged. I was engaged professionally at Medtronic on diabetes issues, and then learned what it was like to be a patient of these medical devices as a parent caregiver. It was the summer of 2003, and our younger son was 9 years old, planning to enter fourth grade in September. And I didn't know much about type 1 diabetes. I knew that starting in July, he started going to the urinating a lot. And then a number of days before he was going off to a week sleepaway camp for the first time, he was actually wetting his bed, which he never did. I, of course, coming from a family of a social worker, where it was group therapy every night at dinner, I thought, well, maybe he's just anxious about going away. So I talked to him about it, and he said, "No, Mom, I'm not anxious about that." But I didn't think anything more of it. He goes away to sleepaway camp. We actually went away as a family to Mexico, and during that time period, he just wasn't acting right, and I began to have an inkling that something might not be okay with him. We got back from Mexico, and we actually had an annual doctor's appointment the Tuesday after I had it planned, scheduled his annual appointment, but he never made it to that appointment because on that Friday, he wanted me to go out and get him like lots of sugar and ice cream and all this stuff, and he was not doing okay. On that Saturday morning, I took him to the pediatrician, and they told me, "Do you want us to call an ambulance, or are you okay to drive? Because we think he has type 1 diabetes." His blood sugars were showing. It was quite a shock. I didn't know that, of course, as a mother, you feel guilty because I didn't know. Here I was in the healthcare field and didn't know about the symptoms of type 1 diabetes. And I decided I didn't want him to have to go through an ambulance. I drove him to the emergency room at the hospital. My husband and other son were in a place where they couldn't get phone calls at the time on that Saturday morning. So I called one of my dear friends and told him, and her husband met us at the emergency room. And it was there he entered ICU. He was on all kinds of, he looked like the Bionic Man. And I didn't realize that he was close to going into a coma because his blood sugars were so high. It's a terribly frightening and out of body experience to go through something like that. And that began our journey with type 1 diabetes. bringing him home from the hospital when they got him stabilized, and he got out of ICU, and I brought him home. But it's like having a baby again, because you don't know how to take care of this baby who's 9 years old and has to have blood sugars taken, on intervals before eating anything. You don't know what to feed them. The first couple of years, there wasn't a lot of the technology that there is now. And so my sleep became lighter again, just like it did when he was a baby. And I would wake up to make sure that he was breathing, that he wasn't sweating, all the telltale signs that would tell me he's going low. Because this fear is that they go so low that they don't wake up. The highs are also scary in a different way, but it was, I had to go and enter a crash course on, as did my husband, and we sort of divided and conquered. He kind of was focused on getting him into a clinical study nearby, since we live in the DC area, and there were studies going on at NIH, because we wanted more eyes, medical eyes on him, not less, and we wanted to see what was out there. And I sort of focused on the day-to-day, the eating, the shots, and all that. It was a lot of work, and it's a blur to me now. And people were calling as they found out, but we just had to, we focused on what help did we need right then, and how did we manage the day to day. Learning how to give shots to your son was not easy. And my husband's brother's wife is a type 1 diabetic. And so she came over. She was fortunately, in the DC area at that time. And she came over and then helped teach us. But ultimately, David said, "Mom, your shots hurt. I'm going to learn how to do this myself." And that was and that kind of shows who he is as a person. And he learned, and he started giving himself shots at age 9. He started school. His class was really supportive. I remember that first week at school, because he started 2 days later, and friends descended upon the house, and we'll go do the grocery shopping. We'll do your back to school shopping. People were there for us, and that was a tremendous help. But I remember being, in the library of the school, and there was only one other woman there. And I didn't know her. I said, "So why are you here?" She said, "Well, my son's starting kindergarten, and he has type 1 diabetes." And I went, "Well, somebody up there is made this meeting happen." She ends up being a very dear friend of mine, helped support us through those early days, because her son had it since age 2. And the technology got better. He went on a pump within like 10 months of his disease. High school was really tough. He's now a 6'2" big guy, but when he was going through those growth spurts, it was really hard to manage the day-to-day blood sugars. And I would get calls from school, and I would have to drop everything. He was my most important client. I dropped everything and ran when the nurses couldn't manage. I had my memo of how to take care of our son that I introduced I changed it over time. I gave it, and I did a little dog and pony show at the school in the fall of every year. And probably the hardest thing for me was when he went away to college. They don't want to hear from the parents. I brought my memo. He's 18 and he's got to learn how to care for himself. Those were tough years, because his A1Cs were super high, and he didn't get good reports back. And he made it through. But there were dips and valleys and highs along the way, both literal and figuratively. And through his 20s, he got more independent. In terms of the life of our younger son now with type 1 diabetes, certainly he views life differently. He views a city where he wants to settle down with his now wife. He just got married in May, and after 11 years of dating the same woman, and he also got his doctorate of psychology in May, and thinks about the healthcare infrastructure of a city, and does it have enough to make him feel safe? Because through his training, he lived in a place where he did not feel safe. He did not feel it had the healthcare infrastructure that if there was breakdown in the city or a weather problem, that he could get the help he needed in time to keep him healthy. And so he looks at the world very differently. Also, when they travel, he looks at the world differently in terms of, can he get the care he needs? And of course, just the 24/7 nature. He's always got to make sure that wherever he goes, he's got the things he needs, from orange juice to a glucagon shot to everything with him, and to make sure that he wears two devices. He wears a pump, and he wears a glucose sensor, and make sure that he's got all the supplies that he needs to keep it current and make sure he doesn't get infection around those sites. So it is, when you think about your normal, just having good health, your normal day to day, this is has to be priority number one, that takes up brain space to make sure you're doing what you need to do to stay safely planted. This disease really impacts the family in a big way. And we were concerned, and I read enough, and my husband had read enough to know that, when you attend to one child to the exclusion of another, it's not good for that son. So we started kind of conquering, and either my husband Elliot would go off and take care of Ben and do something different, special with him, or we would trade places, and we'd make sure to have one-on-one time. But there were also all those scares when he was going low. We were on the phone with the hospital to kind of evaluate, or the doctor to evaluate, do we need to go to the emergency room? And so all those times that all the attention was on him, that we had to work through. And there were times as our older son got older when he was there. And there's a story of when David was going so low, and our older son, we always had icing, sugar icing, and he, had to give him, and rub it on his tongue. And so our younger son always said, Ben saved my life. And so to have that kind of relationship where you're acutely aware as an older sibling that your younger sibling has this kind of disease, that life can change on a dime, is a tremendous responsibility. And how do you still ensure that that child has a childhood where he doesn't feel overly responsible? So it's definitely impacted our older son. As a parent, you want to make it easy for your child. I probably, and I've met many other type 1 parents, and we probably do too much. And the question is, how do you balance that? How do you enable them to become independent with the disease, but make sure that they're safe? Because this is a disease that you can die from. And unfortunately, we know people who have. As I mentioned, that very first day of 4th grade, I met a wonderful woman who was a parent of a type 1 diabetic. And she was already involved in Breakthrough T1D and invited us to the gala that year. And that first year of diagnosis is just a really tough time. And I didn't want to show our son, he knew I was struggling, but I wanted to be there. We wanted to be there for him. And this was a way to join a group that of parents and patients that would really surround our family with a community. And so we went to that first gala in November of 2003, and I probably cried my way through it, but I found a community, and I felt really, it was a club I never wanted to join, but there were really good people there. And it went from there, and I saw the passion. And I don't think, you join certain organizations, but to join an organization where the parents have children with this disease that's a common bond is powerful. And we started doing the walks every year. And of course, it was all about our son and our family. And we made it fun. We got together, we had a breakfast at the walk site, and we fed everybody. We got a team together. All his friends came out for it. We made signs. It was a fun activity, and it was community building. And then, of course, I did it with this woman that I had met, and we started joining forces, and we did the walks together. And people knew they were going to hear from me that time of the year, and people and friends supported us. They came out for us, and it became an annual event. In addition, I organized with then JDRF, now Breakthrough T1D. We used to do wrapping presents in local malls here in the DC area. And I brought all my friends out for that, and the kids came. I went up to one of these gift wrapping things before I got involved that first year. And my voice broke as they told me that they were doing this for type 1 diabetes. And I said, well, my son is a type 1 diabetic. And I still have a lump in my throat when I say this, because it's just a powerful thing when you meet people who are supporting a cause that's like not much closer to your heart. And so the years went on. My husband served on the board. He was treasurer of the board. I was on the board. I did a lot of fundraising, and it just went from there. I'm still very, very active. I meet with the local executive director. I try to help with the gala and get auction items. And our younger son always went, and he was given a budget to buy things at the auction. And so he loved it. You have to make these things sort of a fun and a game, and invited his community of friends. So it was a powerful organization for us, but it was also ended up being quite a powerful organization for him. He ended up speaking at events. When he was 15 or 16, they have a fundraiser that's the real estate games, and they asked him to speak. And so he got his first public speaking experiences through it. He was asked to speak at an FDA advisory panel meeting as a patient of what having type 1 diabetes was like. And so here was the collision of my worlds. I was there on behalf of my company. He was there speaking. And it's heartwarming to see your child take a leadership role in something that is life-changing for him. And then he went on to do a group that we learned through a Breakthrough T1D. We learned about this group that goes to the Dominican Republic to help connect families there that consider it like an end of life sentence. And he helped, and he was there for, I think, a 2-week, 3-week period, helping families understand, look at me. It's not the end of life. It's like, I can do a lot. I can do everything. And so, and then of course it affected the course of his career, because he ended up choosing to want to help these kids. I credit Breakthrough T1D to really giving us a foundation of making this a source of strength. Other than having children, it's probably the most transformational thing that has ever happened in my life as a person, as a mother, as a caregiver. And it changed the way I looked at my work, because here I was in the medical device area, and I saw the impact that disease has on a family. And I saw the incredible benefits that medical inventions can play in the quality of life for these patients. And that's why I'm so passionate about iTolerance, because I see a path. So often immunosuppression drugs create risks of infections and cancers, and can lessen the efficacy of the transplanted cells. And so it's the hope for a true cure that has me motivated to bring this to market. And it would have a huge impact. It's actually interesting. It's something that I've thought about and something that our son with diabetes has thought about. Like, there might be a cure in my lifetime. Could it happen? And if it does, when you have your whole personality develop as a child, from child to adulthood, around a 24/7 chronic disease, what does that look like when it's lifted from you? It would be unbelievable. It would give him brain space and heart space that he doesn't currently have because of the space that this disease takes on a daily basis. It would give him more hope for a longer life and fewer risks of all the diseases that he's at a higher risk factor for because of his diabetes and because the impact it has on his organs. I hope and pray and will do whatever I can to help, be part of the solution that will bring the immunosuppression solution that iTolerance is studying to market, because it will have a huge positive change for my son and all of those patients out there with type 1 diabetes.